Hello, my name is Jasmine and today I will be presenting on a procedure called histotripsy. This is considered an outpatient radiologic procedure that takes anywhere from 10 to 90 minutes to perform. In rare cases, patients will stay 24 to 48 hours in the hospital for recovery. The duration of the procedure and the hospital stay are dependent on tumor size and location. So tumorous tissues in the liver, either benign or malignant, are liquefied using high-pitched ultrasound waves. The ultrasound waves are synchronized and very powerful. The patient will be placed under general anesthesia, and then regular ultrasound is used to identify the target tissue. After it's identified, a doctor will apply gel to the area and then aim high-pitched ultrasound waves at this targeted tissue. Tiny bubbles are created in this tissue or tumor with these sound waves. The bubbles expand and then pop in this tumor, which makes the tissue break apart almost instantly. Once the targeted tissue is broken up, the immune system works to discard it.
Histotripsy is a new non-invasive technology that uses focused ultrasound waves to target and destroy cancer tissue in the liver. When the ultrasound waves are transmitted through the body and reach the targeted tissue, they cause vibrations that create high pressure. This pressure creates tiny, naturally occurring gas bubbles known as microbubbles. These microbubbles expand and collapse very quickly, forming a bubble cloud that moves through the targeted tissue directed by the histotripsy machine. The expansion, collapse, and vibrations make the cancer cells break apart completely. This destruction only happens inside the bubble cloud, avoiding damage to tissue that is not targeted. Research indicates that important structures like blood vessels are strong enough to remain intact even as surrounding cancer tissue is destroyed. Unlike conventional therapies, histotripsy only uses mechanical forces rather than chemicals, surgery, or radiation to destroy cancer tissue. As a result, it doesn't create heat or ions that damage healthy DNA, and it preserves antigens, molecules that help the immune system recognize any remaining cancer cells for cleanup. When the cancer cells are destroyed, they leave behind a harmless liquid that gets absorbed and flushed out by the body's natural drainage systems. In weeks and months that follow, the volume of unwanted tissue shrinks. At UChicago Medicine, we have specialized equipment that allows physicians to combine their expertise with robotic precision to plan the ultrasonic wave treatment and monitor it in real time. The histotripsy procedure for removing liver tumors is completely non-invasive, offering the potential to transform the patient experience.
There's a quick video on it. So there are many pros to histotripsy, one of them being that the sound waves and their energy do not affect the surrounding normal tissue. Other pros are that there is minimal potential for complications and short recovery time due to no incision required. Patients should rest and hydrate properly to recover quicker. They can return to daily activities almost immediately and take over-the-counter medications for pain when necessary. Patients who may qualify for this treatment are patients who have increased risk of complications or have had no beneficial results with surgical methods, chemotherapy, or radiation. In order to be a candidate, patients have to have 3 or less tumors. The tumors must measure less than 4 centimeters and it has to be in a favorable location. 2 side effects that may occur with histotripsy are discomfort to the treatment site and nearby tissue may be affected if the targeted tissue is on the liver's outside surface. However, this is rare. A con of this treatment is the cost. It can cost anywhere from $17,000 to $50,000, and some insurances may or may not cover this. This procedure was approved by the FDA in 2023 and has a 85 to 95% success rate. The way that histotripsy is related to ultrasound physics is that it relies on acoustic cavitation. The bubbles that are created with the ultrasound waves are made of vapor. Once the tiny vapor bubbles are in the targeted tissue and implode, the cavitation process occurs. I think this could change the future of ultrasound. It can help open up jobs for skilled sonographers to help assist the doctor during this procedure. Since it has a high success rate, it demonstrates that ultrasound can be helpful with treatment and not only imaging. I predict that histotripsy will be offered for treatment for patients more often. The only issue is the cost and insurance coverage. It seems like a great choice so patients don't have to do radiation, chemotherapy, or surgery for these tumors. I chose this topic because I had never heard of this treatment before. I think it's important to inform ourselves about ultrasound and what it can do. It makes me feel like I will always have something to learn about in ultrasound as my career goes along, and this is very interesting to me. Thank you.